Today I'm going to speak to you about the sociology of health. Health can be viewed as individualistic, meaning the main factors to a person's health is down to their own lifestyle choices and physiology. Sociology looks at the social structures and cultural impacts on health. Sociological research has enhanced our understanding of the medical and health policies, including the patient-provider interaction, the influence of bias on doctors' recommendations, and the unequal access to healthcare reproduces social inequalities in well-being. Sociologists have five main perspectives, including functionalism, Marxism, feminist theory, interactionism, postmodernist theory. Health can mean different things to different people. The World Health Organization in 1946 defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. However, this has been criticized for being too idealistic. There is no single common definition of health, but there are three main concepts or models of health: the negative, positive, and holistic concepts. The negative concept is where the person believes that they are healthy because they are not ill. The absence of disease is considered healthy, and the absence of the person not visiting their GP is considered valued and is healthy. The view is often changed throughout age. If an elderly person has not visited the GP for a few years, they can assume they are healthy. Likewise, a younger person will rate their health in terms of how much physical exercise they do and what their diet consists of. If someone is ill, the negative concept is also prevalent when the individual has recovered quickly. They define their health in this way because they feel healthy, therefore they must be healthy. The WHO defines negative definition of health and well-being as where an individual believes they have a good state of health and well-being because they have nothing wrong with them, i.e. no physical illness, disease, injury, mental stress, and are free from pain and discomfort. In other terms of other sociologist views, such as feminism, feminists think that society has a negative concept of health when it is about women. They feel that some people consider pregnancy, childbirth, menopause, and menstruation, for example, a real illness. Feminists believe that women can be discriminated against because of this. For instance, some young women might not be employed for fear of going off on maternity leave. Strengths and weaknesses of this concept is that if someone believes they are healthy and already have a healthy lifestyle, it may encourage them to continue with this pattern, which is most likely to improve their health. However, if someone believes they are healthy but have an unhealthy lifestyle, it may encourage them to continue with this pattern at the risk of health problems later on in life. Believing that they are free of illness because they have not visited a GP in years does not mean that they are truly healthy and does not give a full picture on how their organs are actually functioning. This poses difficulties for health professionals with giving advice to their patients. For example, if someone has been smoking for 20 years and has never had any serious health issues, the person could assume that they are fit and healthy. The doctor could warn the patient that there could be damaging effects to the lungs that will likely cause problems later on in life. However, because of the negative concept of the individual, they are less likely to change any behaviours. In the positive concept, the individual takes interest in a healthy lifestyle and defines themselves healthy through the things they can do. The individual achieves this by conscious and continuous effort to maintain a healthy lifestyle by being physically fit and having a good mental health. This is done by exercising, eating well, managing stressful situations, and maintaining social life. If the individual can do such things well, then this is an indicator of good health and well-being. The positive model looks at what is rather than what is not. In terms of other sociologist viewpoints, functionalism also fits with this concept. The functionalist approach emphasises that good health and effective healthcare are essential for a society's ability to function. This is supported by the functionalist Talcott Parsons' sick role theory. The strengths and weaknesses of the positive concept is that if the individual is taking responsibility for their health, it builds self and societal awareness on health. It promotes healthy lifestyle, therefore a healthy population equals less cost on the NHS healthcare system. It can improve assets such as biological build-up, the way we feel, feeling more energised, and improves our functionality and our job and relationships, etc. Research by scientists is currently being carried out to see if there is a definite link between health assets and positive health outcomes. Martin Seligman found that people with high life satisfaction are likely to be more optimistic, socially engaged and supported, and manage health problems better. However, there is one negative to this concept, and some people may find it difficult to take responsibility for their health and may need extra support. In the holistic concept, the individual focuses on health and body as a whole, based on the belief that there is a link between physical, emotional, intellectual, spiritual, and social health and general well-being. It also looks at lifestyles of individuals, such as nutritional deficiencies, causes of stress, and why there is a lack of good health. It's rooted in the understanding that all these aspects affect your overall health, and being unwell in one aspect affects you in others. The holistic approach will involve the individual taking responsibility for their health by educating themselves and being active in maintaining and improving their health. In terms of other sociologist viewpoints, functionalists believe we may need different parts of society to maintain a stable society. The holistic approach is about the same thing too. All parts of the body are needed to maintain health. Postmodernism views also society as always changing, and it is hard to pin down what makes a stable society. The holistic view is also similar, as it sees health as something that can change. Our view of whether we are healthy all the time changes all the time with new treatments and disorders that are arising through constant research. The strengths of this concept is that by assessing a range of factors that could contribute to a person's ill health is useful in the care and management of long-term or complex conditions. It's not static, and as life circumstances change, just as our health changes. We can look at the individual's personal values and priorities, as well as taking their environment into account for their physical and mental well-being. However, this can be time-consuming as it is a long-term management of health, and it can cause problems for health professionals as it is not clear on the boundaries and areas of responsibilities. This can risk regaining focus and could treat one specific condition as in the past. This is known as reductionism. So the way that health and illness is socially constructed varies between individuals, social groups and eras. For example, Britain once thought that mental illness was a sign of satanic possession or witchcraft upon which you could be hung for. Since then, there has been an advancement in scientific approaches which has dominated modern medicine and views in society. The medical concept of illness sees disease as a biological and natural condition, whereas sociologists believe that health and illness cannot be completely explained through biology, and there is a sociological element to health. Medical sociologists recognise a link between biological disease and illness, which is a social interpretation of that disease. So social constructionism is a conceptual framework that looks at ill health from a social perspective. Sociologist Conrad and Barker came up with a comprehensive framework for understanding the major findings of the last 50 years of development in social cultural aspects. Their summary categorised the findings in the field under three subheadings: the cultural meaning of illness, the social construction of the illness experience, and the social construction of medical knowledge. So there is an influence of society on health and illness, and society's perception of illness can influence a person's capacity to manage the disease. For example, someone with cancer is described as a cancer victim or sufferer. This makes them more likely to be offered support and sympathy by the communities, whereas people suffering from illnesses and diseases that are stigmatised by society, such as HIV and AIDS, may be morally judged and are less likely to receive support from communities. This could have an effect on their mental health and ability to deal with the disease. Contested diseases like fibromyalgia may not always be recognised by medical professionals due to the belief that it is psychological rather than biological. This can delay diagnosis and treatment, prolonging the healing of the individual. Goffman suggests that we might view illness as a stigma that can push others to view the ill in an undesirable manner. This can influence people to not want to become ill in the fear of being judged and rejected from society. It could be seen as a positive as it promotes a healthier lifestyle. However, not all illnesses can be controlled in this way, and can be onset even if you have a healthy lifestyle, for example, some cancers. So the social construction of health and illness is where the people with illness live up to the role that they perceive their illness to be. It means that they're influenced by their culture, their past experiences and interactions with healthcare professionals. This can affect how or if the person tells other people about their illness and how they manage and cope with their condition. For some people, illness defines and limits who they are. For others, illness can be a chance for discovery, re-imaging and new self. Research suggests that medical knowledge may exacerbate social inequalities such as gender and ethnicity if used in favour of powerful groups. Conrad and Barker use the example of women's health being controlled by fear. In the early 19th century, pregnant women were discouraged from driving or dancing for fear of harming the unborn child. Today, they are discouraged from smoking or drinking alcohol. Feminists would support this research as they believe the traditional medical approach attempts to control and dominate women in favour of men. The social construct of medical knowledge could cause healthcare professionals to be biased upon diagnosing or treatment planning because of their social construct assumptions on the person's gender, race, ethnicity or class. This can lead to inequality in treatment and recovery. However, both social constructivism and traditional biomedical approaches have positive justifiable approaches, which enables health professionals to develop a deeper understanding of health and illness. This can improve patient experience and quality of care. Social construct theories can be further looked at through the use of various approaches as highlighted in the Black Report, such as artifact selection, cultural behavioural and materialist structuralists, which helps us to understand the impact on the NHS and the health of society. In the artifact explanation, this is where they believe that the relationship between social class and health inequality is artificial. Critics say that the statistics in the Black Report focuses too much on the inequalities between the highest and lowest classes, whilst neglecting the improvements in the health of most people. For example, statistics might tell us that one group of people have more ill health than another. However, this group might be more likely to report illness to their doctor or admit that they are ill. Only sickness that is reported is added to the statistics. This suggests that the information that is collected is not actually valid. In the natural social selection explanation, they suggest that class inequalities are a result of biological differences rather than biological differences being the result of class inequalities. Resources in society are not equally distributed across all social classes, causing biological changes long term. Greater chance of poor social classes to suffer from illness and poor health. Another view is the drift hypothesis, where ill health is what causes people to fall into social classes. This is the idea that being unable to work is because of illness causes a downward spiral into poverty. However, data has suggested that high social class people who get ill rarely fall into poverty. Ill health may have an influence on social mobility, but not statistically significant. In the cultural behavioural explanation, it's believed that the social and economic factors affect health directly and indirectly. The behaviour of individuals causing better or worse health. Sometimes this behaviour might be dictated by the culture of society. Social class, race, ethnicity and gender affect illness, as well as lifestyle choices such as diet, smoking, alcohol and drug intake. Some behaviours might be more or less common in certain groups. For example, working classes might have higher smoking rates. Culture factors look at the type of behaviour expected from different groups. For example, men are meant to act tougher and not complain about illness. In the materialist structuralist explanation, social and economic factors in the distribution of health and illness. Political and economy gives advantages. Those receiving advantages are more likely to have a healthier lifestyle and access to healthcare services. Disadvantaged groups are more likely to have a high turnover of jobs and limited access to a healthy lifestyle. The Black Report favours this explanation, expressing the impact of political, social and economic has on people's health. However, critics disagree with this view, believe that poor health is due to high-risk lifestyle choices such as smoking leading to lung cancer or poor diet leading to diabetes. These explanations from the 1980 Black Report have since been criticised, challenged, revised and further developed. More recent attempts to explain health inequalities are the psychosocial and neo-material explanations. It is important to regularly view different explanations and adapt them to the current situation of the world. If we always use the 1980 Black Report explanation, which was set out over 40 years ago, we would never incorporate other influences of the world and society that comes with different time periods and eras. All theories are helpful to understand the link between how health and illness are socially constructed. However, not one explanation gives us a complete answer. It's helpful to conduct a range of research from different perspectives to be able to equally justify and therefore use and inform policy development at local and national levels. So, health and illness has mainly been dominated by the biomedical in Western society, which focuses on the biological factors and excludes psychological, environmental and social influences. This is currently the leading way for healthcare professionals to diagnose and treat a condition. But in recent years, healthcare professionals have recognised that there is a link between mind and body. This has led to therapies being used which fall outside of the traditional biomedical treatments and practice. Social theorists and those practicing alternative medicine therapies or complementary alternative medicines have increased its awareness surrounding its effectiveness and use in treating illness. However, availability of CAMHS on the NHS is limited, and in most cases, NHS will not offer such treatments as there are still some implications. So, one of the most widely used classification structures developed by NCCAM divides CAM into 5 categories. The alternative medical systems is things like homeopathy and naturopathy. You have mind and body interventions such as meditation and mental healing. You have biological-based treatments such as specialised diets, herbal products and other natural products such as minerals. And you have mental manipulative and body-based methods such as chiropractic, and energy therapies such as Reiki and therapeutic touch. Axter, who looked at the way in which CAM therapy has differed through traditional biomedical treatments, identified 3 models of medical thought. The pharmaceutical model uses drugs and technology to treat specific diseases, and the integrational model uses biomedical, sociological, and psychological methods to identify an illness, as a holistic model focuses on total and natural therapy. So who uses CAM therapies and why? There is a strict hierarchy in traditional medicine about who is licensed to do what, and some researchers claim that doctors and other medical staff hold power over the patient. In CAM therapy context, traditional biomedical approaches hold power over and dominate CAM therapies. Marxists will support this theory and believe that power of capitalism shaped the all-powerful pharmaceutical companies that keep CAM therapies in the margins. The British Medical Association stresses that the traditional biomedical approach uses fully qualified and nationally recognised practitioners who are licensed to practice, and the treatments or the norm, implying that CAM therapy treatments may not be, which may deter some people from using CAM. Researchers found that women are more likely to use CAM therapies than men. This is possibly explainable through the feminist view to health, who see the traditional biomedical approach as dominating women in favour to men. Other research has shown that people who use CAM therapies because they want to try out other options, or because it benefits in some ways, or because it feels more natural. It is not because they're dissatisfied with the current traditional biomedical approaches. People with arthritis use CAM therapies for reasons which are very similar to those of cancer patients, i.e. wanting to use more natural treatments, wanting to reduce side effects of traditional treatments, and to relieve symptoms. However, there are implications for healthcare practice. The biomedical and CAM approaches clash. The biomedical approach suggests that it is based on science and evidence, which is therefore objective and true, whereas the CAM approach does not always recognise science-based evidence. Those who have the biomedical perspective may reject CAM theories due to limited research, which makes it very difficult for either practitioners of biomedical or CAM approaches to coincide and give advice, whereas a mixture of both could be very beneficial to the patients. Withholding a particular choice could potentially limit their recovery or disease or cure. The lack of standardisation of CAM makes it more difficult to regulate, as no standard format exists to ensure that practitioners are adequately trained in techniques they use. This can be dangerous for their clients. So these effects can have an impact on patients' pathology, cause complications on their medical conditions, or delay in medical diagnosis. Other issues such as misleading marketing. So there's many dietary supplements and herbal remedies that are mislabeled as natural. Some manufacturers make this unrealistic claims that their products are miracle cures, which can have potentially dangerous interactions. Even cases where the product contains no artificial substances, supplements and herbs can still potentially interact with prescription and over-the-counter medication. Some of these natural products can also have side effects of their own. However, some biomedical prescription drugs also have negative side effects. Paxil, an antidepressant prescription drug, was found to increase suicidality. Avandia, prescribed for treatment of type 2 diabetes, had side effects that included heart and bladder failure and stroke. Both were approved by the Food and Drug Agency, so it is understandable that many people have lost trust in the biomedical approach and prefer to take a more natural approach. The ways in which people understand health and illness vary considerably. Lay understanding is often conflicting with professional understanding of the disease. If a patient has a fixed belief on CAM therapy, it may be hard to persuade the biomedical treatment and vice versa. This would be difficult for the trained professional who may know what is best for their patient, as it risks disrupting the patient-practitioner relationship and trust. As discussed earlier in this presentation, views of society has changed through personal experience, era, gender and culture. Increased interest into CAM therapies has sparked a shift in the training of doctors, nurses and other medical professionals. The profession now pays more attention to social and psychological aspects of care, as well as recognising some CAM therapies. This way they can be advised with correct information for patients to make their own decisions and to prevent misuse. The British Medical Association now recognises that there is a link between body, mind and spirit, and that CAM therapies are beneficial. Hopefully this improves the population and is a positive and holistic approach for individuals taking an active responsibility and reduce costs to the NHS.